Welcome to this explainer, designed specifically for us as medical specialists. Today, we're diving into something I think we often overlook in clinical practice, the systemic role of glycine and how it drives connective tissue restoration. We spend so much time treating the symptoms of aging and structural decline, right? But how often do we trace it back to this fundamental metabolic and dietary gap?
Take a look at this stark clinical mismatch. About 30% of the human body's entire protein matrix is literally collagen. It's our biological scaffolding. But here's the crazy part. Because modern diets are completely obsessed with tender, lean muscle meats, our standard patient intake yields less than 3% of its protein from collagenous sources. That is a massive disconnect between what the human body is built from and what it's actually receiving. So, to break this down, we're going to look at this dietary collagen deficit, explore glycine's role in systemic repair, and unpack the biosignaling peptide pathway. Then we'll hit metabolic and renal regulation, and finally wrap up with a highly actionable clinical tissue restoration protocol you can use with your patients right away. Let's start by unpacking this modern dietary mismatch. Think about it. When our patients are eating nothing but skinless, boneless chicken breasts or lean ground beef, they are missing out on a massive structural component. This severe dietary collagen deficit is a direct trigger for the widespread structural decay we see in the clinic every single day. We're talking joint degradation, thinning hair, loss of skin elasticity, and absolutely crucially, the breakdown of the intestinal defense barrier. Basically, this missing collagen creates a profound systemic shortage of what becomes a conditionally essential amino acid, glycine. Now let's look at how this glycine shortage impacts systemic repair pathways across the body. Because when we actually optimize systemic glycine levels, the clinical outcomes are pretty remarkable. Up in the central nervous system, glycine acts as an inhibitory neurotransmitter. It upregulates GABA, which directly enhances deep, slow-wave delta sleep, meaning your patients actually wake up feeling genuinely refreshed. Down in the GI tract, it physically rebuilds those epithelial tight junctions, fortifying the gut barrier against leaky gut syndrome and localized inflammation. And we absolutely have to talk about the liver. We all know glutathione is the liver's master antioxidant and primary detox compound. But here is the catch. Without enough glycine, hepatic glutathione synthesis essentially grinds to a halt. That leaves your patient's liver incredibly vulnerable to oxidative stress, microplastics, and honestly, the very prescription medications we utilize in our own practices. Glycine is literally the key that keeps that detoxification engine running. Moving on, it's time we challenge a few assumptions about the biosignaling peptide pathway. There's this common misconception out there that eating collagen is useless because it just breaks down into random amino acids. But the reality is, collagen uses a highly specialized dual absorption pathway. Sure, about 90% is broken down to raw structural bricks, but an absolutely essential 10% survives digestion as intact bioactive peptides. They don't just become random amino acids. And those surviving bioactive peptides are a real game changer. They act as potent cellular signaling molecules. They circulate right through the body and bind directly to fibroblast cells. And when they bind, it's like flipping a switch for the body's internal collagen synthesis. They literally command the fibroblasts to start regenerating tissue. So you aren't just handing the body building blocks, you are giving it the architectural blueprints and the workforce to actually rebuild. But this goes way beyond just physical structure. Let's look at metabolic and renal regulation. From a clinical perspective, the glycemic stabilization here is fantastic. Glycine actively enhances cellular insulin sensitivity, meaning it helps clear blood glucose efficiently with a much lower insulin demand. At the same time, it stimulates glucagon secretion to help reduce visceral fat and prevent fatty liver development. And as a fun side note, it preserves the catalase enzyme to neutralize metabolic hydrogen peroxide, which actually helps prevent premature hair graying. Pretty fascinating, right? And for your renal patients, this is huge. Glycine actively competes with uric acid for renal excretion. By speeding up that uric acid clearance, it acts as a natural, highly effective defense against gout flare-ups. Plus, it actively downregulates the formation of calcium oxalate crystals, serving as a frontline nutritional defense to prevent kidney stones. So, what does this all mean for our practice? Let's get into an actionable clinical tissue restoration protocol. To actually close the structural gap for our patients, we can rely on 4 primary nutritional tactics. Fortifying the body to activate those fibroblasts, securing vital enzymatic cofactors, shifting back to whole animal eating habits, and protecting the existing matrix by cutting out processed sugars, stress, and refined seed oils.
To make cellular glycine replenishment as simple as possible for your patients, I recommend guiding them through these 3 really practical steps.
Step 1 is initializing a morning habit. Have them drop 1 scoop, that's roughly 4 to 10 grams, of unflavored hydrolyzed collagen right into their morning coffee or tea. It dissolves seamlessly, it has 0 taste, and it instantly introduces those bioactive signaling peptides right at the start of the day to kickstart cellular and joint repair. Step 2 is absolutely critical, securing the vitamin C cofactor. Now, vitamin C isn't just an optional immune boost here. It is a mandatory enzymatic cofactor. Without it, the body simply cannot structurally cross-link those amino acids into stable, mature collagen strands. If they don't pair that morning supplement with a clean, whole food vitamin C source, the entire biochemical process of collagen synthesis basically fails. And finally, step 3 is the longer-term dietary shift. Patients really need to transition away from exclusively eating lean, skinless muscle meats. We've got to encourage them to reintroduce the ancestral animal-sourced collagen matrix. That means drinking traditional bone broths, preparing slow-cooked whole meats, eating chicken and fish with the skin fully intact, and even utilizing unmodified pork rinds as a great source of natural collagen. I want to leave you with this final thought to consider for your clinical practice. Given the absolute systemic necessity of glycine for everything from hepatic glutathione synthesis and insulin sensitivity to deeply refreshing delta sleep and preventing kidney stones, are we inadvertently doing our patients a huge disservice by blindly recommending exclusively lean meat diets? It might just be time we rethink the optimal nutritional foundation for true cellular regeneration.